It's Health 360 Degrees on Invicta FM 98.9.
Every Friday, 7 p.m. to 8 p.m. with Jackie Aderija. Health 360 Degrees.
Embrace victorious health.
Only on Invicta.
All right, we're back and we are with Dr. AMINA iSMAIL. We're going to take a quick look at some of those common gastrointestinal problems or issues, the ones that are common. And I'm just going to quickly start because we don't have much time anymore. So, Dr. AMINA, let's talk about one of the most common ones where we have children saying, "Oh, mommy, my tummy," you're always complaining about cramps and all of that. So what would be the problem, you think? What causes cramps? What's the most common cause of cramps, especially in children?
Okay, good evening. Okay, yeah, abdominal cramp pain. Let's say abdominal pain in children can be has many causes. It could be from even malaria. Malaria can cause abdominal pain in children. It could be from maybe gastroenteritis. It could also be from urinary tract infection. Then there are also sometimes no cause can be found for abdominal pain in children. Then it can also be caused by sickle cell disease in no sicklers. Abdominal pain is also common when they have their crisis. Yes. Okay. Yeah.
So, is it just that sometimes children just because I hear this thing often?
Yes,
my stomach.
Yes.
My stomach.
Yes.
So, what is it that children just naturally complain about tummy ache? What else could actually cause cramps or tummy ache, especially for children once again?
It could also be caused by when there is obstruction along the intestines. Yes, maybe caused by hernia, maybe umbilical hernia, or some disease conditions, maybe typhoid. Even typhoid fever can also cause obstruction. So all those can also cause abdominal pain in children.
Yes. At what point should one start to get worried, especially about these cramps? Because a lot of mothers, especially when you grow tired, every time my tummy, you get to just rubbing the tummy for them and telling them, go and play.
Yes.
So at what point do you need to say
recurrent, or if the baby is if the child is complaining of severe abdominal pain which prevents him from playing, going to school, and then if there are other symptoms, maybe fever, when there's pain while passing urine, when he's passing loose stool, he or she is passing loose stool, so you bring the patient to the hospital for investigations.
All right, so let's talk about something else that is very, very common, and I'm sure a lot of people out there suffering from it, talking about stomach ulcers. I hear that there are different types. Could you differentiate for us? How many types do we have?
So we can have gastric ulcer or duodenal ulcer. Those are the main types. Yes.
Gastric or
duodenal. Yes, gastric, that's the one in the stomach that occurs in the stomach. While the duodenal are more along the intestine, the small intestine. Duodenum is first part of the small intestine. Yes.
What causes the one in the stomach that you call gastric?
So usually if there is infection, there are risk factors actually, maybe from diet, from family history sometimes, then stress. Stress, because stress makes one to be taking all junk foods, all these foods that can irritate the stomach. One may be prone to develop ulcers. Then if there is infection, usually there may be infection with Helicobacter pylori. It's a bacteria. So these are the main
culprits that cause
factors.
Okay, so is it that I read somewhere that there's the one that is caused by that old people are more prone to having that one, and then the other one, young people are more prone. So which one is which?
That's the stomach.
Okay.
That's the gastric. That's the one is commoner among the older people.
Okay.
Or the duodenal is commoner in the younger ones.
Why? Is it still this Helicobacter that causes both the one in the stomach? That could be a causative factor.
It could be. It's more, the Helicobacter pylori is more of the gastric.
Okay, in the stomach.
Yes. Then the ulcer. Ulcer, it's like a mucosa wound. It's not like it's as deep as wound. Yes, but the ones that most people complain may not really be the ulcer, except if an endoscopy is done. That's when a camera will be inserted through the mouth into the stomach, and then and then it will be viewed through the camera.
So that's the only time when you can really tell the difference.
That's when you will be able to confirm that it's an ulceration. There are other conditions that we will be giving you those symptoms and you think that it's an ulcer, but we commonly, even in the hospitals, we say, do you have ulcer? Because that's how people view it. But there are other reflux. Some is reflux disease. There is this gastroesophageal reflux disease. When this gullet, that's the esophagus.
Yes.
So when the sphincter, there is a sphincter at the lower, the one that connects it to the stomach. So when that sphincter is relaxed, so there will be reflux of the contents from the stomach. That's when okay. So even that one, then some will be complaining of heartburn. You understand? So sometimes it's not really the ulcer, except if you do that endoscopy. That's the confirmatory test investigation that you do.
Let's quickly go back to this GERD, the gastroesophageal reflux disease.
Yeah.
Is it common in people who eat late?
Yes, it is.
Because we debated this thing with someone. I was saying, look, it's not what I've heard. And correct me, Dr. Ismail, if this is wrong. But what I've heard is that there must be at least 3 hours between when you last ate and when you go down to bed.
At least maybe 2 to 3 hours.
Okay. Okay.
Yes.
So true. People who just eat and then
lie down, yes. They are at risk, actually. And especially if you take all these caffeine containing foods, oily foods.
What about swallow?
We are swallow. It depends.
No, because this person told me that, once you have...
if you have if you put so much pepper inside, and if it's oily, you can also trigger it. Yes. Because
this person said, once you've belched, once you've done gyaza, you're good to go. No. Whether you just finished eating, you just belch, you can go to bed.
No. Unless if you can sleep while reclining for maybe 2 hours. That one may help. But ideally, one is supposed to stop eating 2 hours to sleep time.
Still dwelling on this matter, it's good that this thing just came up, this matter of eating late. People who have big tummies and don't take beer, don't take alcohol, because I know that alcohol is also a causative factor. But people who eat late, are they not also prone to having big tummies?
Yes. But we women that have started giving birth to children, the women in the reproductive age, usually most of us
have big tummies.
Yes.
But anyway, that is another issue altogether, doctor, because I always wonder why. At first I used to think, this is a white people thing. It's because of the way our bodies were made by God. Thinking about why white women seem to have their stomachs snap back quickly after childbirth more than us, and they don't even do all the koni, all the burning with hot water that we do in these climes. But we still have these pouches that we carry around. A lot of African women do have that. Many who don't actually had to go for surgery.
Yes.
But I realized that even African Americans also somehow snap back, at least for those whose...
Even the whites. Maybe it's the ones that we see on media. because they also battle with obesity there.
Right.
Yes.
I know.
Obesity is even more there.
More. Yes.
Even though it could be more here, but because we don't document, we may not have the real
figures.
Yes, the real figures.
Right. Let me quickly open up the phone line so that people can at least ask a few questions before you have to go today. You're listening to Dr. Amina Ismail. We touched briefly on, common gastrointestinal issues. We talked about the cramps, especially from children where they're complaining, my tummy. Now we've heard that one of the most common causes too could be either typhoid or malaria, you said?
Yes, malaria.
Even malaria.
And urinary tract infection.
And urinary tract infections.
Yes.
Okay. All right. So, and we talked also about ulcer, quickly differentiated between the stomach ulcer and the duodenal ulcer. Time for us to get to hear from you. I know that network is not our friend, but let's see if you can get through. If you have a serious question you want to ask, you could send that question to the number 09072703270. If not, let's try our luck with the lines, and the lines are open. The numbers are 081 40,000 989 and 07087 989. Once again, that's 081 40,000 989 and 07087 989. Okay, like I said, I know that's the lines, the network is not our friend on this side of town, so we're just going to take your calls as they come. All right, someone has been lucky enough to get through. Hello, good evening.
Hello, good evening.
Good evening, you're welcome. Your name?
Good evening, yes, my name is Isaac.
You're welcome, Ike, go ahead.
Yes, I want to ask you, what of the like me, I'm normally close for work. And I'm normally around, sometime around 11. So, again, my stomach is still flat. Is it mean...
You're one of the lucky ones. You're one of the lucky ones, Ike. But how old are you, if I may ask?
I'm still 35.
So you see, don't laugh yet. It might be is that tummy is it has reversed and is coming back with speed. So don't be too sure that you won't have a tummy just yet.
Okay.
Anyway, so what's your question though? Jokes apart, what's your question?
My question is, you have side effects.
Eating late, right?
Yes.
Okay. All right. Dr. Ismail will answer you. Thank you for your question, and lucky you that you were able to come through. All right. So apart from having a pouch or a protruding tummy, Dr. Ismail, are there other negative side effects to eating late?
Yes. The others, mainly the gain of weight gain, and then one also may be prone to, from the weight gain, one may be prone to other disease conditions, high cholesterol level, these cancers, then all these osteoarthritis, the one that we discussed, the topic we discussed before.
Some time ago.
Yes. Yeah.
Eating late could also cause that.
Yes.
Oh, wow.
Because the metabolism of the carbohydrates will still be going on, and it's from there the carbohydrate will be converted to the fats. Then fats will be stored in the tissues.
Right.
Yes.
So you gain weight, and then of course all the joints start to complain.
Yes.
Okay. Still waiting for your calls. If you can get through, we still have about some 10-12 minutes before we have to go this evening. And you have with us, we have with us this evening Dr. Amina Ismail. We touched briefly on common gastrointestinal issues, particularly cramps and ulcers. Before she came in, I was talking about ways in which you could get some exercise done, especially if you have a sedentary job, lifestyle where you're sitting all the time. Like I said, and it's great that you're here, Doc. So let me just slip this in and ask you, if you cannot stand for 30 minutes straight, does it say something about your fitness?
No, standing may not really be an active form of exercise.
Okay.
It may even predispose one to the hypotension that we discussed too. Yes. So maybe brisk walking or jogging, maybe at least 3 times in a week. About maybe
okay, no, I'm not
45
talking
minutes.
of exercising. We have a call. Please let me
Okay.
take this. Hello, good evening. And that call got cut off. Sorry, I was about to pick that. I wasn't talking about exercising. I'm saying to test your fitness as a person.
Yes.
If you cannot stand for 30 minutes straight, what would you say as a doctor? If I had to stand in line somewhere and I couldn't stand for 30 minutes, like I told you, Doc, there was one time I stood during that time when we used to rush for trains and all of that. I stood from Kaduna to Abuja, and I didn't really feel it. I didn't sit on my box. I was actually just standing. Of course, because of the swaying of the train, I leaned against the wall, but I didn't feel it. This time around, I was at a workshop and I couldn't stand for 30 minutes just to let sleep pass by. You know, I didn't want to fall asleep, so I wanted to stand. And I just found out that I was looking for how to hold on to my chair. I didn't stand for like 10-15 minutes and I sat down and I was worried.
Maybe then maybe you didn't eat anything. You know, when the glucose level is low.
You know, our workshops, we had actually taken tea. Let me not give myself excuses. We had taken tea, we had taken water, and even snacks. So I don't think it was about food. I think, I don't know. I don't know.
Maybe with age, when you are younger, you tend to be able to do those things. And then train, like if it's a military, all these military personnel, they may not have issues with this.
Exactly.
Yes,
so we're coming back trained.
Yes.
So you're coming back to what I'm saying, that it is a sign that you are not fit if you cannot stand for at least 30 minutes.
Yes.
Well, that's what the conclusion I came to. Still taking your calls anyway with Dr. AMINA iSMAIL. We're keeping it pretty informal today, and you can call in to ask whatever question that you feel that you really need to ask this evening. But I think for those who are listening, you already have caught that eating late is not good for you. There are people who actually wake up and eat. People who wake up around 11, 12, and that's when they start to feel hungry. I've had someone wake up and take Eba. Like Eba at 12 a.m. in the morning.
The person was very hungry, or maybe the person didn't eat before sleeping.
And you have to eat like Eba. People take beans in the night, and I'm like wondering, how is this going to digest? But then some people have quick metabolisms, don't they?
It depends, yes.
Talking about metabolism, we're talking about gastrointestinal issues. Taking tablets, I want to touch on this because this is something that I have done, and I think it harmed me in many ways than one. Taking supplements that are said to increase your metabolism. Is it a good thing, Doc?
So it may not be. It depends. It's better you see a specialist, but usually it's in steps. Are you talking about losing weight?
Yes.
Okay. So that one is in steps actually. When you see a specialist, then you start from exercising, eating moderately. Then when it reaches the stage but then you can start the drugs. If all these 3 don't work, all these initial steps don't work, then one has to go for surgery. That's for the morbidly obese whose BMI is high. Yes.
Okay.
Or up to 40.
Right.
Yes.
Okay.
Yes.
How do we know BMI?
So that's the body mass index. So it's calculated using weight and height.
Okay.
So if it's the normal BMI is 18.5 to 25, that's the normal range. Yes. If it's less than 18.5, that's underweight. Yes.
If it's
25 to 30, that's overweight. 35 to 40, that's obese. Then that one, 35 to 40, that or higher, that's morbidly obese.
And these figures are African, like we're not using Caucasian numbers.
It's from the Caucasians.
It's from the Caucasians.
Yes, but some argue that the BMI may not be the ideal way to calculate it. Some use this waist to hip circumference ratio. Yes.
Okay.
And it's different for males and females. Yes.
Okay. Now, just to chip this in, also talking about how to get in exercise, especially in times when people are, obsessed or
with sedentary lifestyle.
With sedentary lifestyle, but so much to think about.
Yes,
you're thinking about your pocket, so much stress.
Yes,
so exercise has taken a back seat.
Yes.
Now, for women, why is it that you would see a woman who works hard at housework, but she's not losing weight? Like, you're not seeing that
depends
thing on her body.
Genetics. Some is genetics. Yes, if the parents are obese and then or they are on the bigger side, so some, no matter what you do, but some is just maybe it's from our food. Yes,
because there are lots of people
a lot of junk foods now. Yes, and we don't eat a lot of fiber.
A lot of fiber.
Yes, and fruits and water. Yes.
Water, particularly, I hear water indeed water is life.
Yes.
We keep saying that, but we don't practice it.
We don't practice it. Yes.
Well, we've run out of time, and I'm not surprised. I knew this was going to happen. But as you go, Dr. Amina, looking at all that we've talked about today, what would your words be to those who are listening?
Okay, let's eat moderately, then exercise regularly. And also I advise us to imbibe the habit of health checkup. Yes.
Health checkup.
Yes.
That's another one that we hardly do, because you start
then
thinking of
eating. We should remember that we should reduce all these carbonated drinks, the ones where we like Coke, Sprite. Yes, a lot of sugary foods. Even all these pastries, these cakes that we take. Yes, and also sometimes you can make it healthier. Like some cakes, there are some cakes that sugar may not be used.
Okay.
Yes.
We have people making those kind of cakes now.
Yes. Then for this, all these fries, so you can use healthier oils like olive oil or sunflower oil.
In fact, Doc, right now that you can fry with air. There are air fryers where you don't put oil, you just fry.
Yes.
It's actually possible.
Yes. Then we also use these cooking methods. It's better we use boiling, baking, steaming, or grilling
instead of frying.
Yes, avoid too much frying. But it's not. It's easier said than done.
But it is training. It's what you train your body. Yes. Discipline.
Yes.
We need to discipline ourselves. Yes. And if there are a people who need to work at preventive medicine more than curative, it would be Africans, particularly Nigerians, because our health sector is still growing.
Yes.
So anything that you can do to keep yourself healthy.
Yes.
Those are the things that we need to do. Dr. Amina Ismail, thank you so much.
Yeah, welcome. Till next time.
Till next time when we have you within our studios once again. Until then, remember that you need to get in. Fidget. That's another thing quickly. Just fidget. And when I say fidget, just be that kind of person who cannot sit still for too long. Is a very good thing to work towards. Don't be that kind of person who just sinks into the chair, and just be that person who's reaching for this, doing that. I hear that every little movement counts. That's why they call people who just sit down couch potatoes.
Couch potatoes,
you just sit down there and just you don't move.
Television.
Yeah, especially watching TV, watching movies. Like shake your leg, snap your fingers, do something. Just keep moving. Keep moving, people. Dr. Amina Ismail, thank you so much. Until next week when we come your way again. Apologies for not starting early today. But as you know, doctors live first before they come and give us information. Until when we have you once again, Dr. Amina Ismail, remain victorious, we say to you.
Thank you.
And to all of you out there too, do have a great weekend.
Give me that.